Yes, here to do Smart Lipo. I met Dr. Adelglass about, I would say, 15 years ago. Has been a colleague of mine, and several years back when he started the Skintastics, we started talking just about what he did and what he could do. So it was always interesting. I was always interested in liposuction, but was very afraid of the downtime and the invasiveness of the whole thing. So it wasn't anything that I was really, I don't think, ever going to do. It was just kind of the, oh, someday I wish I could, but I don't think I ever would. And then I spoke with Dr. Adelglass about a year ago about the Smart Lipo. So I did some research and got some more information from him and really got excited about the thought of trying that, because it is very much so less invasive, less downtime, up to work the next day, and so I'm pretty excited about it. I own a research business, but actually kind of a farm girl. Live on a big farm and have horses and play with my horses and do that stuff, so it's kind of fun. You know, Texas is a nice place to visit, but my heart's in Kentucky. I have had microdermabrasion in the past, which to me was almost addictive, because it immediately is a glow that you get, and you can go from wearing makeup one day to not wearing makeup after a microdermabrasion, and it was phenomenal. So there was a time, I think, that I was kind of hooked on that a little bit. Now I just do it every now and then when I kind of feel I need that lift, but very nice, yeah. Okay, well, here I am. It's 8:30 in the morning, Tuesday morning, and today is the day for the Smart Lipo. I'm actually not very nervous. I'm kind of excited about it. I'm ready to go and get this over with.
What we're going to do now is we're going to mark the patient for the Smart Liposuction procedure. We start off with the upper abdomen. We use these circular lines which really emphasize the raised adipose tissue, which is the fat tissue. As we continue marking, we mark on each side of the upper abdomen. We really want to show where those raised areas are, so the patient gets the best result from this procedure. We go to the lower abdomen. We go just above the suprapubic area and over back to the lateral sides. As we continue on, we want to really feel the area to show where that fat tissue is. We blend the abdominal area into the lateral side and go around to the back. Then we'll do the exact same thing on the other side. We really use that touch to feel where that tissue is that we're going to perform the procedure on. It really helps us greatly. As we come back around, we finish up, and it's time for the patient to go to the OR. There's going to be a little stick in your arm here in just a sec. Here we go. And that's it. That wasn't too bad, was it? As you can see, our patient is really comfortable during this procedure. During Smart Liposuction, we use a conscious sedation anesthesia on the patient. It makes it extremely comfortable for the patient. As you can see, it's very short acting. The medications that we use last approximately 45 minutes to an hour. It's significantly safer than going under a general anesthesia where you have to breathe for the patient and things like that.
This is Dr. Adelglass actually doing Smart Lipo on a patient. You'll notice the size of the cannula. It is much smaller than what was previously used for liposuction. The Smart Lipo also has the double effect of tightening the skin by stimulating collagen. That's why Dr. Adelglass uses a fanning motion to make sure it gets all of the area covered. It not only stimulates collagen, but it liquefies the fat. This gives you a twofold effect that was not previously available. And now with this effect, we can really make a major improvement in your waistline.
Wow, surprised. I feel great. I have no pain, no discomfort. They tell me that some of this may wear off and it may be a little bit, but I feel like I've done nothing. And it's amazing. It's amazing. It's amazing to look over and see the jars of fat that came out. You're like, how could I have that much? But I did. And so no, I'm really excited. It went much better than I ever expected. I feel great. I feel like I could go do whatever I wanted. And they're saying, no, don't do that. Relax for a day or so. But I feel great. It took about 2 hours, I think. And we talked. I was awake and we chatted. and felt absolutely nothing. No, even a twinge of discomfort. The surgical staff was very lighthearted, and we joked, and they made me feel very comfortable and very confident about their abilities and skills. And so it's, I think it really is better than I thought the outcome would be.
This is Debbie. She is 2 days post-op. Already a dramatic effect. Show us from the side, and then back to the front. She's just about stopped draining.
Mm-hmm. Yesterday, completely.
Completely stopped draining. You can see the little dots. These are as big as your dots get. And that's where we went in with the cannulas. She's very, very mild swelling down at the bottom. Mild bruising, as you can see. Now remember, gravity works really well, so the fluid that was in your abdomen ends up going down. So that's why it's a little bit more poochy down here. Although even with the swelling, she's significantly smaller than she was pre-operatively. And Richard will show you pre-op pictures in the video, I'm certain. So this is 2 days post-op. Now she's still going to get some swelling. This isn't going to be perfect yet. But in a couple of months, I have a feeling, and you can already see the definition coming in here, that she will probably have a six-pack. And the hourglass shape from the sides comes in. She was originally almost out like this. So hourglass shape, V coming in, and we have 1, 2, 3, 4 dots per side, and that's really all that you have post-operatively. The draining stop, wear the compression for another week, and you will be set and ready to go. Thank you so much for your time.
Yay.